Good morning. I see you're here because you're experiencing pain in your arm. Can you tell me when it started and if you've had any history of blood clots, trauma, or repetitive strain injuries?
我大約2個星期之前開始覺得痛，特別係搬咗啲重嘅盒之後，仲有我右邊膊頭同前臂有腫脹。
It sounds like it could be Paget-Schroetter syndrome, also known as effort thrombosis. This is a rare condition where repetitive movement leads to compression of the subclavian vein, causing blood flow obstruction. Have you also been experiencing numbness, tingling, or weakness in your fingers or hand?
有，我有時會覺得針吉嘅感覺，特別係用咗手臂好耐之後，仲有手經常覺得凍。
These symptoms are consistent with thoracic outlet syndrome, which can cause venous compression. In Paget-Schroetter syndrome, the subclavian vein becomes compressed between the clavicle and the first rib, leading to venous thrombosis. This can impede blood flow, causing the swelling and discomfort you're experiencing.
我哋可以採取啲咩步驟嚟治療佢？藥物夠唔夠？定係需要做手術？
Treatment typically begins with anticoagulation therapy to prevent further clot formation. We may prescribe medications such as heparin or warfarin, and in some cases, we may recommend thrombolysis, a procedure where a clot-dissolving drug is directly injected into the clot. Surgery may be required if the vein remains blocked or if there is significant vascular damage.
手術有咩風險？有冇潛在嘅併發症我應該留意？
The risks include infection, bleeding, nerve injury, and blood vessel damage. There's also a small risk of recurrence of the condition, especially if the underlying compression isn't fully relieved. However, the risk of complications is low, and the majority of patients experience significant improvement after surgery.
如果唔需要手術，喺服藥期間點樣管理症狀？
If surgery is not necessary, managing the condition conservatively with anticoagulant therapy and physical therapy is often effective. You may also be prescribed pain management medications such as nonsteroidal anti-inflammatory drugs. Additionally, we'll work on improving posture and reducing the strain on the shoulder muscles through stretching exercises and strengthening routines.
我需唔需要調整日常活動，例如工作或者運動？
Yes, for the time being, I recommend avoiding activities that require heavy lifting or repetitive motions, particularly those that put strain on the shoulder. You should also try to avoid positions that compress the thoracic outlet, such as raising your arms above your head for long periods. Low-impact exercises like swimming or walking are generally safe, but we'll tailor your activity level to your specific recovery needs.
有啲咩我可以做嚟預防以後再發生？
Preventing recurrence involves avoiding repetitive trauma to the shoulder and maintaining good posture. Strengthening exercises for the upper body, especially the shoulder muscles, can help prevent compression of the thoracic outlet. Maintaining a healthy weight and staying active will also improve circulation and reduce your risk of blood clots.
有冇可能會發生喺我另一隻手？
It's possible but less common unless you engage in similar repetitive movements with the other arm. If you have a predisposition to clotting or anatomical abnormalities on both sides, the risk might be higher.
多謝醫生，我好感激你提供嘅資訊。
You're welcome. We'll now perform diagnostic imaging to confirm the diagnosis. A Doppler ultrasound is often the first step because it helps visualize blood flow in the vein and detect any clots. If necessary, we may follow up with a CT venogram or Mr. venogram for more detailed imaging of the veins and surrounding structures. These tests will also help us determine the extent of the compression and clot formation.
我需唔需要驗血？
Yes, we'll order blood tests to check for clotting disorders, such as factor V Leiden or antiphospholipid syndrome. These tests will help us understand if you have an underlying predisposition to forming blood clots.
我可唔可以繼續上班，定係應該休息一陣？
It depends on how severe your symptoms are. If you're able to manage your symptoms and the swelling isn't too bad, you can continue with light duties that don't strain the arm. However, if you're lifting heavy objects or performing tasks that could aggravate the condition, I would advise taking time off to rest and allow the treatment to work.
多謝醫生，我好感。
You're welcome. We'll work together on a treatment plan to help you recover fully. If you have any questions or notice changes in your condition, don't hesitate to reach out.